All right. I'm gonna give it to 10:03 and then we're gonna go ahead and get started. All right. Nice size group today. All right. So we're going to go ahead and get started. Welcome, everybody, and Happy New Year. It's the Fentanyl Work Group's first meeting of this year. And I see quite a few new names and faces. So I'll give a really brief overview of how this work group started, just to give you some background if you're not aware. So Phoenix Recovery Support Services is a recovery home on the west side of Chicago for men. And one of the problems we ran into, or challenges we ran into, is that if one of our residents appeared to be under the influence, as our process is, we would give them a drug screen, but we were using fentanyl test strips to test them as well. They would test positive for fentanyl, test negative on all the other panels on the rapid urine screens. We would send them to a detox center and they would send them back to us because they were not testing for fentanyl, which interrupted their recovery process. What we wanted them to do is to go and get stabilized and then ideally come back to us. And so I presented this problem to Lee, and we started this work group to talk about this, to see what other providers were experiencing, to learn more about fentanyl. And that started this group, and we've been able to accomplish quite a few things working together. The group has had people kind of come and go. There's been a core group that has stayed, and everybody is contributing and putting in work and sharing information. So it's been a wonderful example of how recovery homes, treatment providers, hospitals, educators, everybody can just kind of come together and get things done on the West Side. I think this group is a great example of how collaboration can really make changes, right? Or affect change. So recently, towards the end of last year, one of the things that came up was that the whole thing about fentanyl testing, not to be punitive, but as a tool, and then to make sure that people with substance use disorder are able to get the care they need, right? And so Dr. Huggett reached out to Super and asked if they could assist us with getting the rapid urine test, getting the ones with the fentanyl panel in it, CLIA, waived, FDA approved. So apparently there has been some work to get it FDA approved, but it hasn't moved forward. They are not CLIA waived. So that's kind of where we've been the last month or so. So we had a meeting with Super at the end of last year, a couple meetings actually, and kind of a recap of that meeting is we talked about no CLIA waived fentanyl testing available and what that means for providers. So for us, we do have a CLIA waiver and we risk getting sanctions if we use them because they're not approved, right? But it's crucial to us making sure that our residents get the care they need, that the recovery process is not interrupted. We need to know that, and it can be a valuable tool for providers as well, right? Not a way of diagnosing them or anything like that, but a tool. That's something we definitely need to know. So Dr. Sorrell has done some incredible research and found 2 states that are kind of going through this process as well, Massachusetts and Connecticut. And so let me pull up the PowerPoint to kind of walk through some of this. So the summary of the recent work, as I just went through, we talked about the CLIA waived test. We had the meeting with Super. We're going to talk about some of the state responses, right? Massachusetts and Connecticut. And then Dr. Sorrell again found some academic and foundational support. And then what are the next steps? So in July, as a result of the work of this work group, Super sent out, we had a meeting with Director Jones, I missed that part, right? At Super, where he kind of heard us out and we shared what we were experiencing as providers. And as a result, Super sent out a smart alert with guidance about testing, that urine screen should not be the basis of whether someone gets into detox or not. You know, they could, there can be an assessment done and you could use the DSM to diagnose them. And so that went out in July with quite a bit of guidance around testing for fentanyl and test in general. And then we realized that fentanyl tests are not CLIA waived, either the strips or the panels that are included in some very few cups, right? And then how that could be a barrier to services, particular, you know, for our residents and others with substance use disorder. And some of the provider concerns, one of them, namely, is sanctions for using non-CLIA waived test. Let's see here. So why is this so important? Why is it so important for us to test? So we all know, if we work in the field, that fentanyl is out there, right? And it seems to be trending to be the primary drug. There's very little heroin out there. And so 82% of deaths in Illinois in 2020, the numbers are still coming in, and I took a look at them yesterday. They're slightly higher for 2021, but 82% of Illinois deaths involve fentanyl. In Chicago, 91% of overdose deaths involve fentanyl. Those numbers are insane, right? So it's so important to know what people are using and being able to test for it for multiple reasons. So in the Super meeting, it was a fentanyl work group, Dr. Gastala, Kimberly Fernero, Jamila Han, Laura Garcia, and the fentanyl work group is made up of a multitude of people, as I said, different providers, hospitals, educators, and it really and truly felt like we were both advocates from all these different areas and partners. And I have to say that Super has been amazing in their willingness to not only meet and hear us out, but also to help and take action. So that has been a big win for this work group. I truly feel like we're partners in this. So some of the state responses in Massachusetts, the governor requested approval be expedited for fentanyl testing, both the strips and the cups, the panels and the cups. In Connecticut, the state legislator requested a state level response to Congress for approval of the testing. And the work group will be continuing to do some research to see what is going on in places across the country around this issue, because it's a nationwide issue. Academic and foundational support. So the Eleanor Health Foundation, they're recommending congressional approval. ASAM has reported their concerns and they're recommending approval. And the Journal of Addiction Medicine also recommends approval for them. Their point of view is more effective pain management. We need to be able to test, well, they need to be able to test for fentanyl to see if it's in their system to better be able to assess and work with the patient to have more effective pain management. So there's a lot of support for this. A lot of people know that there is a need. So the action items that we left with last year was to possibly have Super send out an addendum to the initial SMART alert in July, stating that, and we've got, confirmation from them that we will not be sanctioned if we use non-CLIA wave test, which is huge. And that information needs to be shared with providers. And so maybe that will remove the barrier for them to use fentanyl testing. Promote and advocate for FDA approval at the state level, and continue to do research as a work group on this issue. So I did see Dr. Sorrell on, spoke to her. So Dr. Sorrell, do you have anything that you would like to add?
As the other day, Ivana, this was very thorough and a great review of the progress made so far. A number of states, just as you mentioned, have been having these similar issues. So as we move forward, I think we'll gain momentum as more, and as hopefully the pandemic allows the FDA to move past some of the urgent approvals and emergency use authorizations that they've had to focus on. But being able to have boots on the ground to continue the work in progress here is going to be the big important part. So thanks for the work that you've done in leading the fentanyl group so far, for the work that we've been able to accomplish.
Yeah, thank you, Dr. Sorrell. Yeah, does anybody have any questions or would like us to dive deeper on any of this? As I said, I see a lot of new faces. And so if you have questions, please feel free to ask or to comment. If you're a provider that have experienced these issues as well. Anybody? Okay. All right. So one of the so we're going to continue the work that we've already been doing. We're going to continue on that track. But as I said in the beginning, this work group has been amazing in the things that we've been able to accomplish in the short time that we've been together as a group. And so one of the things we wanted to talk about today is kind of poll everybody to see what are some of the emerging challenges that you are facing that we could possibly tackle or needs to have attention brought to it. So if anybody has experienced anything around fentanyl, right, testing or otherwise, it'd be great to hear it here to see what we can do together.
Ivana,
yes.
couple things I'd like to note. Can you hear me okay? Can't tell.
Yes.
I'd like to hear a follow-up on our fentanyl fact sheet. You know, as a biomedical researcher and educator, I think that type of thing is a useful mechanism by which we can keep people informed with the newest information that's coming down the pipeline about the effects of fentanyl. And I know that the work group spent some time putting together a first draft, and I'd like to encourage us to continue that on in 2022 as well. So maybe an update in that arena would be nice.
Absolutely. So we did come together. Dr. Napier got us started with a fentanyl worksheet, and it was a collaborative effort. Everybody contributed to it, and it actually turned out as it's a beautiful piece and very informative. And I think it will reach across all areas, right? So providers, people in the community, and I'm going to see if I can actually share that, put that in the chat for those here. So we also, the fentanyl work group also has information depositories. So all articles and documents, we've kind of been collecting all this information about fentanyl, and we can make it available. I believe, Lee, you have the link to that. If not, we can send it out to everybody who's on this.
I don't let's do that. That'd be great.
Okay.
Afterwards, yeah.
We can email the link to everybody. So if you need information on fentanyl, that's a great place to get some of it. And I am going to see if I can put the fact sheet here in the chat for everybody. And please feel free to share. We've shared it with the West Side Heroin Opioid Task Force group, everybody who is on those meetings. We shared it with all those who have been to the fentanyl work group meetings, and we encourage you to share it with communities, providers, whomever, right? So yes, Dr. Napier, we will continue to use that and distribute it as widely as we can, because I do think it's incredibly, incredibly helpful. It's really good work. So I'm going to try to multitask here. Hey,
Couple, while you're,
go ahead.
You don't have to multi because I'll take over one of the tasks.
Okay.
I just want to mention that fact sheet has been included in the packets that the outreach team has been giving out. So probably since inception. So there's probably been about 400 people that have gotten that in their packet of information. And also when you do see it, it should be in an editable PDF form. So at the bottom where it shows, the contact information for the task force, like myself and Lucius, you could always put your own organization's contact information in there as well. We have our logo on there so everybody knows it comes from the task force and you all, but you can personalize it for your own particular group.
Great. All right. Any other issues or questions that anybody has? No? Okay. So Lee and I were speaking yesterday. Lee, do you want to speak to the first responders, the challenges that we've had in that area?
I think that's for another meeting, to tell you the truth.
Okay.
Okay. I'd really be interested in, I don't want to put him on the spot, but we do have Taylor Wood from CRA that does some of the runs some of the drug testing. And I don't know if there's any perspective that you have that would be helpful for us at this moment in time as to what you're seeing out there.
I guess I can more so.
Just come here, play it.
Okay.
People, Raj, can you mute while Taylor's talking? Speak, please. Thank you, sir.
I can more so just speak on how fentanyl is primarily the predominant opiate of action in the street supply. That is fairly, unfortunately at this point, that is a given. There are other substances as well that don't register with fentanyl test strips, but so far those have been in low number, thankfully. But that also should be on the horizon. Similar effects, just different structure completely. I have things outside of fentanyl, but aside from that, yeah, fentanyl is primarily the main agent. So far, I haven't seen any samples that contain fentanyl analogs without fentanyl itself present. So that has been thankful, at least in still being able to determine those being present. But there could be a time when that isn't the case, but at least right in this very moment it is.
All right.
Thank you.
Great. Taylor, I'd be interested to hear more about what your organization does in detail. I think most of us here are familiar, but maybe some of us are not. So I'd love if you could tell us more about what CRA does.
Absolutely. So we initially were a syringe exchange. So we've always provided to communities in need just safe supply in those ways, like safe in injection materials, safe use kits. Later on, we were able to supply naloxone, both nasal and IM. And then my department was recently developed within the past 3.5 years to provide PWUDs the ability to see either prior or after use to determine what's in the substances. And this kind of enables individuals to make the best decisions for themselves. So let's say people come to us to check a sample that they believe is cocaine or MDMA. If it's not what they think it is, they don't end up taking it. So that helps avoid a negative situation. And then those who have come in and have found fentanyl present typically take less of the substance.
Yeah,
So
we
that
will
helps
be
with
after
many,
tomorrow for sure.
overdose situations. And in those moments too, we can provide kind of trainings and information on how to revive an overdose, as well as just safer practices in general. Yeah.
Okay, great. Thank you. Thank you for sharing that. All right. Again, any questions, concerns that you guys have in your own organizations that you would like to share with the group and we could possibly tackle?
Yeah, we don't want to have you, feel that we've got it all wrapped up, because it's a moving target, and it affects organizations and individuals at different levels. So we're, been working at kind of a state level and a system level, but there's some real specific street level issues around fentanyl, et cetera. Please, I think this is a great forum because we can, we don't want to be missing the details.
This is Dave Jimenez with COIP. I had a question for folks on the call. If they've been able to develop any particular messaging strategies for trying to reach folks who are snorting versus injecting, because a lot of our work that we do has been primarily focused on injectors.
Right.
As you all know, the really disproportionate mortality rate with overdose has been mainly among African-American men. So I'm wondering, has there been any kind of talk about particular messaging, for that group?
Yeah, so as a group, I don't know that we've kind of separated out intravenous drug users as opposed to other, ways of doing the drugs. It's the message has been the message, but that's actually a really good point, right? Because maybe people who snort aren't as aware or concerned about fentanyl as people who are IV drug users. I don't know, maybe they don't think, and so that's a great point to target them as well, because they both are at risk of overdose, right, because of the drug. So yeah, that's something that we can definitely look into. Have you guys done any work on that or have attempted to at
We've
all?
been, yeah, so really more in our mobile work, we've been seeing a lot more snorters that are coming to our van on the west side. I think it's maybe more of an issue of focusing outreach for that subgroup. And I think part of that though is, and I know CRA is reaching, snorters as well, but it's maybe making a campaign, kind of thinking about a campaign, informational campaign to let people know that, what the risks are, and in that harm reduction programs aren't just for injectors, they're for everyone. They're for anyone that's at risk for overdose and other services. We all offer other services for folks. So maybe I guess what I'm raising here is the idea of some kind of informational campaign. And that could be, another way to get buy-in from community members of why this is important to provide in our communities that we're in.
Absolutely. Yeah, John makes a really good point that snorters are typically less engaged with outreach programs, because they're kind of focusing on syringe exchanges, fentanyl test strips distribution, Narcan distribution. So John, do you want to speak a little bit to that?
Taylor and CRA would probably be able to talk about it more extensively, but yeah, for the, in the work that I've done with needle exchange programs or syringe service programs, those programs are typically geared towards people who inject. So it's often seen by those who snort as opposed to inject drugs as maybe not a space for them. So we see less engagement with those programs, historically speaking. So, I think some of the work that CRA and COIP is doing is trying to close those gaps. So.
Yeah, great point. So absolutely, that is something we can begin to focus on and talk about. Maybe we get with Lou and Lee and talk about how we reach those people and what that looks like for them on the street. Yeah, get with CRA and talk about that a little further offline.
I saw Taylor had his hand up. I don't know if you put it back down.
Taylor?
I was just going to chip in really quickly. We did, and through confirmatory testing, we found one crack cocaine sample to contain fentanyl in the sense that it looked like it was genuinely meant to be there versus a cross-contamination situation, which we do also see, but haven't seen. I should back up. In many of the dope samples, we've seen low levels of cocaine, but very low levels, like less than what the fentanyl would be at. So in that situation, I see it as a cross-contamination, but this was, it was a crack sample with fentanyl at the right proportion. And I think for people who do snort, they could occasionally snort, crack cocaine, and then that could be a very dangerous situation for them. So I do think targeting or broadening the reach from just those who inject would be a positive thing. Just to reaffirm that in a way, and to also put that on the horizon as well.
Yeah. Taylor, I have to ask, because we hear a lot, right? As providers, we hear stuff from the residents, we hear stuff from other providers. And one of the things that keeps coming up is that there's fentanyl in basically all of the drug supply, right? So we've even had conversations about people who were marijuana smokers and they were tested for fentanyl as well. And fentanyl showed up in their drug screens, and they had no idea that they were consuming fentanyl. But is that true? Have you seen that fentanyl is basically in all of the drugs.
To me, and what I've personally seen, that's not true, at
Okay.
least in terms of cannabis. I can't say that that's not possible, because it really genuinely anyone could combine two substances together and then say this is present in this, and so that's always possible. But in terms of like supply lines, it doesn't seem likely in those sense.
Okay.
There was also a period of time where a specific lot number of the fentanyl test strips were hyperreactive to methamphetamine as well as MDMA. And this caused many false positives. And in addition to that, panic, or I should say likewise panic. So I think many of those reports came from that as well, at least through confirmatory testing. With drugs data, I also haven't seen any of that data to back it up, at least within the United States. In terms of cannabis being adulterated, I do see outside of the United States, it's typically adulterated with things that we knew in the past as spice or K2. Those synthetic cannabinoids are still around and have been found also in the dope supply, but not here specifically in Chicago. So I think there is kind of a fentanyl panic, but I still think we should be very mindful of it. And in a way, I feel, to cocaine users and to crack cocaine users, to stimulant users, they should have access to fentanyl test strips, because they would be most likely to, if they consume fentanyl and they don't have a tolerance, that it's going to be a very dangerous situation. But unfortunately, fentanyl has been around so long now that it is predominant in a lot of the dope supplies. So just for their tolerances, it's different. Sorry, I kind of veered off a little bit there.
No, that's all really good information for all of us. Thank you. Thank you
Absolutely.
for sharing.
No, thank you. Yeah, appreciate you being on. I do want to mention, and maybe some of the outreach team can mention this. I mean, we've known about the difference between routes of administration, and the fentanyl information that we're giving folks and the conversations they're having, really, it pretty much covers the snorting and the smoking side. I mean, and most of the folks that are pretty much out there and been engaged in the in use for a long time know what's happening with fentanyl, and not that they're seeking it out per se, but they know of it and have some kind of routine to either go slow or test it out, or so there is some wisdom of that. Any of the Lou's team want to mention that?
Hey, Lee.
Yeah.
Hi. Yeah, I would just like to say that's some great information. I'm sorry I missed the first part of it, but yeah, we from talking to the population that we work with out there, yeah, we are aware of the fact that we've been getting information that there's been some, I don't know if it was contamination or actually the mixture on purpose, that there has been some overdoses we heard of, but we didn't witness it, that there was even an overdose with some cannabis that was used out there. We're not sure, but they called us and told us to check out a site. We normally get calls from the community and the people that's out there about the use. And I reversed an overdose this few days ago, and I'm curious as to what was in it. We didn't test it or anything, but just from knowing the people, I was curious myself of what happened, because the person, I knew them, and I'm going to do a little bit more looking into it with him, because it was really unknown and it was a surprise, but it did happen. So I guess we are learning and picking up on stuff each day as we go. And I heard you talking about the people that do snort and smoke. And I think we seem to run across that more now than we do any other indulgence. So what we can do is keep our eyes and ears open, and we're looking to get our group trained to actually get more of the fentanyl test strips and kits out. I didn't want to do it until we had been trained properly, because we don't like to give the community misinformation. So, and if Gail or some of the other teams on, they might have something to say on that, because they work directly with the people, and they have more of a conversation sometimes than I do. Thank you.
Thanks, Lou. All right. Anybody else have any questions, comments, things they would like to share, or challenges they would like to bring to the group so that we can help you tackle that challenge?
You know, Tanya, Dr. Stroh put a couple comments in the chat, and as did Dr. Napier. Oh, you put the link in, or you put the?
I did. I put our fentanyl fact sheet into the chat for anyone who would like to have that, share that. It's really good information. All right. Okay, we may have a short meeting today, which is never a bad thing, right?
You know, I do
So-
want to mention, I know I'm the guy that says, everybody goes, oh no, we're gonna stay longer, but I think Dr. Sproul really kind of hit one piece that's happening, and a lot of discussion through the harm reduction community is about the myth that fentanyl can be absorbed through skin and cause overdoses of people who are not using, or anybody, and that is a myth that we need to make sure that we're knocking down. Dr. Sproul, did you want to fill in any of the gaps on that?
I think that's basically the main issue. I know there were a couple of stories, and this was mostly East Coast, where either law enforcement in interacting with someone that they were attempting to obtain, someone may have quote unquote passed out, or one of the law enforcement persons passed out, and it was assumed that it was through some type of fentanyl absorption through their skin. There was also a couple of recent reports at some emergency rooms where medical providers had apparently, quote unquote, absorbed the fentanyl through the skin, through someone they were working with, or through a patient contact they were working with. And although we work after the fact to try to dispel that information, you know, as we know with misinformation, as we're learning from a number of areas that are going out now, the damage control is never as effective as the initial damage from the misinformation. So really working to decrease that likelihood, because unfortunately, it also not only concerns family members about actually even physical touch with those persons who may be using substances for fear, it also can be stigmatizing for the law enforcement community as well in working with these clients.
Right, thank you.
I don't know if we had a statement about that in that on that tip sheet on the back. That might be something we might want to come back to revisit in the future.
Sure.
The other thing I was going to mention right quick, I know Taylor, Antonio, Luther, as we're trying to look at differing types of outreach too, we mentioned that vape stores, trying to find potential areas where non-IV users, are there more places that there might be more likely to congregate? Are those, if you guys can give us information or forward us information as to where might be some of those locations, as we're preparing some additional community outreach efforts, that can be something that we can try to incorporate too.
Sounds good. Thank you.
Taylor? Yeah, Taylor has his hand up.
Vape stores, I think that's actually, that would get a great swath of, I think, the intended target audiences. I don't have any data to match between vape users and you know, people who indulge in other things, but I feel like that would be a good swath to target. I think also potentially something that I've wanted to do with our mobile units, but we've predominantly been targeting the opioid crisis because we want to meet where the most at need is. But I've always kind of thought of the idea of, because a lot of bars, restaurants, even clubs would love to have drug checking, but because of liability, it's not plausible. There's no way. You can't have people try and work past security and then present substances to be checked. That would be absurd. But if there was a service that had a mobile unit that could then go to these areas and provide these services, that kind of skirts a lot of that liability and it places it into the, you know, a different sector entirely, while still reaching, you know, various different communities. So I feel if vape stores are kind of an aim, places like Smart Bar or other venues that have a lot of traffic, you know, it'd be a great way to kind of advertise in those ways. So I think that's a great idea. Sorry.
Great.
Oh, and also about the fentanyl, I originally wanted to mention fentanyl is really scary. It's terrifying. I remember the first time I had a sample that was just fentanyl. Like I felt like I had somehow ingested it and I got scared. And it isn't how it works though. You can't absorb it through your skin. It's not airborne necessarily. So it's really, I think law enforcement are trained to be fearful of it. And then when they encounter it on the field, they have a reaction that this thing could kill me. And same with some medical professionals. I had the same thing in my situation. So I think the way we speak of it is very important. And unfortunately that initial fear in that way has kind of hurt us a little bit. So I'm glad that we are speaking on that.
And you have some general suggestions for somebody who's going to be handling what they, you know, a sample of anything? You're talking about, you know, gloves, that kind of thing?
I think it's always just in great practice to wear gloves, at least in those ways. I don't think there is any danger unless if you have an open wound on your hand to handle the substances, but just a general practice, I think it's beneficial to wear gloves. A mask isn't necessary, but I think in ways it can provide comfort. Also because of COVID, I'm always in a mask wearing habit. So I'm always wearing a mask unless if I'm at home now. Mm-hmm. And I can't really see a future without mask wearing in those ways.
Yeah.
But I think just in terms of cross-contamination perhaps and being mindful anytime you're handling a new substance, a new pair of gloves, and just, yeah, a mask just for general comfort, really.
Gotcha. Thanks. And by the way, I put a link to the Illinois Access Narcan. Probably everybody knows about that, but the state now, if you enroll as a drug overdose prevention program, you can get basically an unlimited supply of Narcan, the nasal spray, at no charge. I think you can get, you know, there's a certain quantity per request, but there is a link in there for that. And you know, I know we had some law enforcement folks on here. That includes police departments, includes medical personnel, businesses, not-for-profits. And we at the task force would be glad to assist anybody or answer any questions.
Absolutely. All right, so the last items on the agenda is the two that I've already been asking, if anybody is experiencing any emergent challenges, things that are new that have not presented themselves before, or if any of the agencies, providers on this meeting today have any needs that we could possibly assist with. If there is nothing you can come up with today while we're on the meeting and you think about something later, please feel free to reach out to myself or to Lee. I'm putting you out there, Lee.
Okay.
Both of our emails are in the chat. And let us know. I mean, anything around this issue that you may need help with or have questions about, we will work to assist you and assist our community to get the answers or to find a solution to whatever the challenge may be.
Vonna, real quick.
Yes.
We could definitely use a mobile warming unit for the next month.
A mobile warming unit?
Yes.
Okay, so Lee, we're gonna have to figure out how to get them a mobile warming unit.
No
And I
hands were
promise you,
raised?
I'm gonna try. At least I'm gonna make some phone calls. Like, how do we make this happen? Yes, we will do what we can. I will begin the process, Lou.
Great.
Yeah. All right, you guys. So if there is nothing else, thank you all again for joining this meeting today. Feel free to email either myself or Lee if you have questions, comments, need assistance with anything around this issue. All right. And I hope you have a wonderful rest of the day and stay warm.
Yeah, and we'll send a summary out. So if you don't have your information in the chat, please do it so we can get it to you.
Okay. Yeah, for anybody who hasn't put their information in the chat, please do so now so we can capture it. We'll stay on for a few minutes just so you can do that, okay? Thank you all. All right. Okie dokie. This is a pretty quiet meeting.
Yeah, thank you for information, your suggestions, Celeste. We'll take, I think that's a moving or a ever-changeable, updatable information packet.
Yeah, I really love what we started here, and I think we can meet more and more needs. I mean, I think this whole idea of these different comparisons about routes of administration is something that you could put in a very simple little message that you could hand out sort of as a conversation emerges, and that might be simple. I really think the idea of some fact sheet that would be useful for anyone who has to handle fentanyl and belaying those fears, I think that's brilliant. And I also think part of this came from that fentanyl was invented to be a patch and it was absorbed through the skin. So, that's the natural progression of, pharmacokinetics in terms of one's thinking. And so I think that's a really important message that I hadn't thought about. And we certainly are in a position to put together something that's appropriate, useful, and accurate. And I see that the strength of this group is that we can say stuff and double check ourselves and make sure that the message that we're getting is indeed accurate.
Right.
And like Lee, you're saying, it's got our logo on it, and that sort of should be a sort of, certificate of accuracy. I like this. And I think that to get more of these fact sheets that are simple, I was messaging Tanya about this as an educator, simple, straightforward, and they can be pulled as needed to where it's sort of subject specific. I would certainly love that as a goal for us for 2022. We're the group to do it.
Yes, I agree.
Yeah,
100%.
So guys, I noticed a young woman, Heidi Riemann, who was on here for the first time. I think she's now gone. She's a graduate student at the Northeastern Illinois University. They're the only addiction education program, I believe, that's in the Chicago area. I had one of their ex-students who came to my lab, and he's now a brilliant PhD. I was trying to message her directly. If you see her pop up again, I'd really like to sort of engage some of these young people and see if they're using us as a resource for their outreach experiences. They have experiential educational programs there, as well as maybe even their thesis proposals. I would really like to help this move forward. So that's the first time I've seen a graduate student jump in on one of these meetings. This is great.
You know, my
saw
partner, Sharon Todd is the grants management person at Northeastern. So I'll talk to her about connecting with that department.
Excellent.
Great.
Thank you, Lee. I love it. I think this is a wonderful opportunity to get really highly engaged, smart, enthusiastic young people involved in some of these goals that we have. Thank you.
Yeah, and they always have
Absolutely.
strategy for activities too. So thinking out of the box for new ideas as well.
Right.
Yeah. Vonna,
Yeah.
did you get that email about the Malcolm X?
I did. Thank you. Thank you. Yes, appreciate it.
This is kind of the meeting after the meeting, but I'm kind of interested. Dr. Nance, is this group meeting your needs in terms of your perspective? And are we using your perspective enough in this group? I don't know if you heard me. That's okay. I wanted to make sure.
He's muted.
Yeah, I know.
Yeah,
And I don't
but
think he heard me say.
Mhm.
Yeah.
Hey, Taylor, thank
So-
you for being on, by the way. Thanks a lot.
Absolutely.
Yes,
Thank you for having
that
me.
was invaluable. Yes, thank you. Great information. Maybe he couldn't
think
hear.
he
Now
can
he can
hear.
hear you, Lee.
Hey, Dr. Nance, I just was asking if you this met your needs, or if you had some comments or any information that you want. Kind of the meeting after the meeting. We're not meeting. We didn't plan on this, but
Good, Lee. Thanks a lot, man. I was multitasking. Sorry, I left
Sure.
for a moment, you know.
that
Trying to,
happens.
yeah, I'm trying to access my dissertation and it's been published a long time ago and having difficulties getting it.
Yeah.
Okay.
So I'm glad to see you on. Please, feel free to shoot us an email or whatever if there's some other things you want to look at, some other perspectives you want to look at this at. So
Thank you. I am interested in, did you send us that fact sheet that I heard about earlier from last year?
she just
Okay, it's
posted
probably-
it. She posted, she being Vonna, posted it in our chat there. I can
Oh,
shoot
is
it
it-
to you. I can shoot it to you.
You can shoot it to me by email, please, Lee?
Yeah, sure.
Okay, thank you. I appreciate
Yeah.
it.
Will do. All right.
Hi,
Well, I'm gonna,
Lady. That for me as well. And hi, Dr. Nash.
Hi, how are you?
I'm well, thank you.
it's the impactful Dee Dee. She's a mover
I'm like
shaker.
Dr. Nash casting over here.
Say it again.
Now, I said I'm like you. I'm multitasking. I'm doing two things at once. But
That's all
someone
right.
told
We
me
all, that's all our modes these days. And to that,
I was told
probably
you can't.
let's sign out, and then I'll be able to get all this together for you. All right.
All right, you guys.
Take care.
Enjoy the rest of your day. All
Thank
right,
you.
bye-bye.